many ketamine treatments do I need, and when will I feel better? Since ketamine is not FDA approved for depression, we don't have clear guidelines on how many treatments you need and when you will feel better. But we do have some research that addresses this and many years of experience to guide us. Many studies initially were done with giving one ketamine infusion, and these studies showed that it could work almost immediately, but the effects also wore off quickly, sometimes within a week. Later, more studies were done that seemed to show that if you gave a series of infusions, around 6, on average within a 2 to 3 week period, the positive effects would be more sustained. We don't have a whole lot more research studies on long-term maintenance. What our real experience has shown us is that most people will see some benefit within the first 6 treatments. Those dramatic responses that you may hear about, where people get one infusion, may be true, but it may also be more likely in those who have had a more immediate decline in their mood or an acute episode, rather than those with more chronic, lingering depression. Also, a dramatic response can mean you're just better and not actually well. If you're so depressed that you can't function or you're having suicidal thoughts, feeling better can be a big relief, but it doesn't mean you're doing as well as you could or should. There will always be those who may need fewer or more than 6 treatments to notice a change, but I expect most will notice something during that time frame. So if you get a response and feel better, we encourage people to then do another month of weekly ketamine infusions to help sustain the response. After that, we start to push the treatments out to once a month, then maybe every 2 months, and so on until we see how far they can go before their symptoms come back, if they ever do. We have many in our clinic that find they may need monthly treatments or they start to backslide. Some go 2 or 3 months, and some just call us when they need us. That could be once or twice a year. Now, that doesn't sound very scientific, but even with traditional antidepressant medicines that have been around for 50 years, it's not so clear on how long you need to stay on your medicine, and there's a lot of variability on how long people need to take them to maintain the positive benefits. We've also seen people get 20-30% better after 6 treatments and then get even more benefit over time. Some don't see a lot of improvement after their 6 treatments, but then a few weeks later they'll notice feeling much better with their antidepressant medicine. The theory behind this is that ketamine increases neurotrophic factors in the brain. They're like brain food or fertilizer, and the medicines that they're on can have more positive effects. Check out my video on how ketamine works for more about this. But this is just a theory, and we really don't know for sure why this occurs. We've had many patients feel there wasn't much change during the first 6 treatments, and then inform us that all of a sudden things got a lot better within a few weeks of stopping the ketamine treatment. Many of those have now continued with maintenance infusions. Right now, we don't know of any long-term risks getting boosters every 1 to 3 months, but clinics all over are monitoring for that. We know there are risks when people abuse ketamine as a street drug, but there are a lot of other factors on why that may be the case, and that may not likely apply to medically supervised low-dose ketamine used in depression treatment. Often people develop tolerance to the ketamine dose and may need to get higher doses over time. Also, people ask if they can stop their antidepressant if they respond to ketamine. My response is that if your depression is a recent issue and not something you've had for many years, or not a strong family history of depression, you may be able to stop your antidepressant. But if you've had multiple episodes of depression, a history of chronic depression going on many years, or a strong family history, you most likely will need to stay on medicine. And being on medicine may be more likely to allow you to push the treatments out further. If you have other questions about ketamine or other treatments for depression, check out our other videos.